Hello, I am Nurul Athar, PMP, CBAHI and RTL certified, and welcome to my presentation on data/information management for leaders and other relevant staff. I have prepared this presentation in compliance with JCI MOI.7 standard and CBAHI MOI.5 standards. JCI stands for Joint Commission Internationals and CBAHI stands for the Saudi Central Board of Accreditation for Healthcare Institutions. Finally, link is available at end of this presentation to get your certificate of completion. Okay. As per CBAHI MOI.5 standard, hospital leaders as well as users and other staff receive education and training on data management relevant to their roles and responsibilities. Okay, MOI 5.1 standard required that there is an education training process for decision makers and other relevant staff on the principle of data management. Okay, MOI 5.2, the data management education training is appropriate to the staff roles and responsibility within the hospitals. And MOI 5.3, the data management education training include but is not limited to following MOI 5.3.1, selection and use of indicators, measurement in assessment and improvement of work process. MOI 5.3.2, data collection and analysis. MOI 5.3.3, use of data and information for decision making. And MOI 5.3.4, data/information confidentiality and security. Now we'll see what is JCI requirement. JCI standard MOI 7 require that decision makers and other staff members are educated and trained in principle of information use and management. Intent of MOI 7, individuals in hospital who generate, collect, analyze and use data and information are educated and trained to effectively participate in using and managing information. This education and training enable this individual to first understand security and confidentiality of data information, use measurement instrument, statistical tools and data analysis methods, assist in interpreting data, use data and information to help in decision making, educate and support the participation of patients and families in care process, and use measure to assess and to improve care and work processes. Okay, I have divided my talk into following main areas: data/information management in healthcare, data collection, processing and analysis, selection and use of indicators in assessment and improvement of work processes in healthcare, decision making. What is difference between healthcare dashboard versus scorecards, and data/information confidentiality, privacy and security in healthcare. Now let's go to the first topic, data/information management in healthcare. Data are simply facts or figures, bits of information but not information itself. When data are processed, interpreted, organized, structured or presented as so as to make them meaningful or useful, they are called information. Information provides context for data. Now we'll see how data become wisdom. Data, it's become information, then it's become knowledge, and then it's become wisdom. Now we'll see this picture. So primary data counts some. We have 35,000 individuals in our population with diabetes. Now we'll see the secondary data, average rates. The patient cost US 7,000 this year, a 15% increase over last years. Okay, now this data become information, benchmarks, trends. The national prevalence rate for diabetes is 8.3%, ours is 12%. Hypertension is a measure comorbidity for diabetes. Knowledge, goals, targets. Assign patient level risk scores using a statistical model to predict which diabetes will be hospitalized next year. Now wisdom, actionable information. Efficiently allocate care management resources to help reduce avoidable hospitalization for at-risk patients. Healthcare data management definitions. Healthcare data management is the process of storing, protecting, and analyzing data pulled from diverse sources. Managing the wealth of available healthcare data allows health systems to create holistic views of patients, personalize treatment, improve communication, and enhance health outcomes. Benefit of healthcare data management. Create a 360-degree view of patient by integrating patient data from all available sources. Improve patient engagement with predictive modeling and analysis based on healthcare data. Improve population health outcomes by tracking current healthcare trends and predicting upcoming ones. Make informed, high-impact business decisions based on data insights. How can organizations unify data management approach? A picture is worth thousands of words. This picture clearly shows how using technology like healthcare application like electronic healthcare record system and customer relationship management applications, websites and patient portal and email, etc. can help us to organize data management in healthcare. Okay. What is Health Information Exchange? Health Information Exchange allows healthcare professional and patient to appropriately access and securely share a patient medical information. Okay. Let's see, this is Health Information Exchange. Using this, it's possible to exchange health information from various organizations, hospitals, like hospital labs, physician practice, laboratories, etc. Okay. Now we'll see data collection, processing, and analysis. Data collection, processing, and analysis. First, acquiring data. Acquisition involves collecting or adding to the data holdings. There are several methods of acquiring data. Collecting new data. Using your own previously collected data. Reusing someone else's data. Purchasing data acquired from internet, for example text, social media, photos. Data processing, a series of actions or steps performed on data to verify, organize, transform, integrate and extract data in an appropriate output for subsequent use. Methods of processing must be rigorously documented to ensure the utility and integrity of the data. Data analysis involves action and methods performed on data that help describe facts, detect patterns, develop explanation, and test hypotheses. This includes data quality assurance, statistical data analysis, modeling, and interpretation of results. Okay. This diagram shows how data collection, processing, and analysis take place using applications. Here we see source of data like finance department, electronic medical record, laboratory, pharmacy, human resource department, payroll, surgery center, etc. So using a tool, it's called ETL tools, extract, transform, and load. Okay, data is transferred to data warehouse. What's happened in this step is data clean. Okay. Conditions, scrub, merge, validate, confirm, anomaly detect, and mapping. If any error, data will be go back to source data. Here now data is transferring to data warehouse. This process we call fully integrated and standardized historical one version of truth. Okay. Metadata mean that is data about data. Now here customization is taking place. Okay, there is a risk management, service line, disease specific, KPI, patient costing, finance, operating room. Now here client can generate ad hoc query, scorecards, reports, graphs and charts, multi-dimensional data mining. Okay. Data preservation and reuse. Data preservation involves actions and procedure to keep data for future use and includes data archiving and or data submission to data repository. Data preservation needs data description, documentation and metadata. The goal of all these actions is to make data findable, comprehensible and easy to use. It also involves long-term preservation and curation of data. Documentation provides an overview of the research context and design, data collection methods, data preparation and results or findings, and is key to enabling the secondary user to make informed use of the data. Metadata are providing standardized structure information explaining the purpose, origin, time references, geographic location, creator, access condition, and terms of use of data. DOI, Digital Object Identifier, is a unique and persistent identifier, makes data easy to find and cite data sets. Data reuse mean data mining, replication, research, and comparative studies, longitudinal research, etc. For example, data collected for one research objective can be used in new study dealing with some other similar problem. What are the best practices for healthcare data management? Making effective use of technology is essential to successful healthcare data management. Healthcare information system can collect, store, evaluate and generate reports of patients' data, alleviating the burden of trying to manage this manually. Okay, this picture shows integrated healthcare information system, how it's work. Integrated healthcare information system integrate pharmacy, laboratory, nurse, physician, public health institution, hospitals, patients, health protection and safety work, etc. Okay, in a single database. What is mHealth tools and patient portal? It make it easier for patient to interact with healthcare organizations like this. Patient can monitor his BP, blood pressures using this device. Okay. Now we'll move to our third topic, selection and use of indicators in assessment and improvement of work process in healthcare, also known as decision making. Selection and use of indicators in assessment and improvement of work process decision making. KPI example for the healthcare organization. Okay, these example reflect KPI used in healthcare organization like average length of stay, average 30-day readmission rates, average treatment cost, all ages. Okay. Average hospital stay. Evaluate the amount of time your patients are staying in your facilities after admission. Performance indicators after different evaluation over this KPI, you may set a target length of stay according to types of stay and procedure that you would like to achieve. Okay, this diagram shows length of stay. Okay, average length of stay. Treatment cost. Calculate how much operation costs to your facility. This is a typical healthcare KPI example for monetary management. Treatment costs are important metrics to track as they directly impact your finance, the contribution margin you make, and the capacity of your facility to sustain itself. Okay, this diagram shows average treatment cost by age group. Now we'll move to our 4 topics: healthcare dashboard versus scorecards. Healthcare dashboard versus scorecards. Measuring and sustaining outcome improvement in healthcare is top priority for industry leaders, but when it comes to the best tool for job, healthcare leaders find themselves in a scorecard versus dashboard debate. Healthcare dashboard and scorecards used in tandem, sometimes referred as scoreboards, is the best way to measure and sustain outcomes. This diagram shows an example of difference between a scorecard and dashboard. A scorecard, it's for leaders. Dashboard is for frontline staff. What it do? Scorecard used for strategic planning and dashboard for operational. When we use it, scorecard daily, weekly or monthly. A dashboard is real time or near real time. How? Enforce accountability. Scorecard, yes. Dashboard, no. Drill down capability. Scorecard, no. Dashboard, yes. Inform root cause. Scorecard, no. Dashboard, yes. Provide actionable data, yes. Data reported should always be actionable or it is not worth reporting. Okay, a dashboard, yes. Data reported should always be actionable or it's not worth reporting. Supports outcome improvement, yes. Scorecard support, yes. And dashboard support, yes. Now let's see scorecards. Strategic, high level and long term. Scorecard for leaders. Healthcare leaders use scorecards to enforce ownerships and accountability by assigning key stakeholders to each strategic goal. Leaders who have influence over employees and processes. Okay, this diagram shows an example of scorecards. Okay, there is a goal to finance department, people and clinical. Okay, finance department, patient information accuracy rate, target is 99%. Who is owner? Paul is owner. Review frequency monthly, and this is the time. Okay, time limit August 16, September 16, October 16. Okay. Now we'll see the dashboard is operational in depth and real time. Unlike their long-term strategic scorecards counterparts, dashboard provide real-time or near real-time operational information encompassing tactical scenarios. Scorecards tell health system how they are doing overall. Dashboard tells system what is happening now using interactive metrics with drill-down capabilities. Dashboard for the frontline. Okay, this picture shows an example of dashboard. How it looks: wait time by hours, average wait, patient distress, waiting, discharge and transfer, nursing ratio, patient and nurse. Okay, there is one nurse on 3 patients. Current room status: occupied 14, dirty 7, in process 2, available 4, reserved 2. Now we'll move to our last topic: data information, confidentiality, privacy and security in healthcare. Data information, confidentiality, privacy and security in healthcare. Confidentiality in healthcare refers to the obligation of professionals who have access to patient records or communication to hold that information in confidence. Privacy. Privacy, as distinct from confidentiality, is viewed as a right of the individual client or patient to be let alone and make decisions about how personal information is shared. Security refers directly to protection and specifically to means and used to protect the privacy of health information and support professionals in holding that information confidence. The concept of security has long applied to healthcare record in paper form. Locked file cabinets are simple example. As use of electronic health record system grew and transmission of health data to support billing became the norm, the need for regulatory guidelines specific to electronic health information became more apparent. Confidentiality. Everyone in organization is responsible for patient confidentiality. Board members, executive leadership, clinical staff, physicians and nurses, administrative and clerical staff, students and interns, and volunteers. Confidentiality. The following is the list of patient information that must remain confidential. Identity, for example, name, address, social security number, date of birth, etc. Physical condition, emotional conditions, financial information. Confidentiality guidelines principle. Access patient information only if there is a need to know. Discard confidential information appropriately, for example, locked, trash bin, or shredders. Do not discuss confidential matter where others might overhear, for example, cafeteria, elevator, buses, or restaurant. Don't leave patient chart or files unattended. Report suspicious activities that may compromise patient confidentiality to the organization privacy officer. Privacy. What is PHI? PHI stands for Protected Health Information, includes demographic information that identifies an individual and is created or received by healthcare providers, health plan, employer, or healthcare clearinghouse. Relates to past, present, or future physical or mental health or condition of an individual. Describe the past, present, or future payment for the provision of healthcare to an individual. Privacy. Where is PHI found? Medical records, patient information systems, billing information, test results, x-rays, clinical lists, label on IV bags, patient manuals, conversations, telephone notes, patient information on mobile devices. Privacy. Permitted use and disclosure of PHI include treatment of the patients, direct patient care, coordination of care, consultation, referral to other healthcare providers, payment of healthcare bills, operations related to healthcare, research when approved by Institutional Review Board (IRB), required by law, for example, subpoena, court order, etc., etc. Need to know. Employees should only use access the minimum necessary information to perform their jobs. Security. When we protect patient data, we help build trust between patient and providers. Ensure protected health information is not disclosed to unauthorized person. Don't send email containing protected health information unless it is encrypted. Log off your computer if you have to leave your workstation. To log off, press the Ctrl-Alt key at the same time on the keyboard and then choose log off. If you suspect someone is using your login ID, you must report to the information security section immediately. Security. Passwords are only effective if they are never shared and if the guidelines for creating a strong password are followed. Strong passwords must be at least 8 character long. Use mixed upper and lowercase letters. Incorporate at least one number. Don't contain repeating or consecutive letters or number. For example, 1 2 3 4 or A B B B are not common words or phrases. Don't share your password with anyone, including co-workers, supervisor, or help desk. Don't write down your password or include password in emails. Tips to protect patient confidentiality, privacy, and security. Things before you act. Never look at patient's record out of curiosity, even with good intention. Follow the minimum necessary standard. Double check names and phone numbers before sending PHI by fax or email. Log out of your computer if you have to leave your workstation. Never share your password. Never share passwords. Familiarize yourself with the organization notice of privacy practice. Question might be asked during the leadership interview. Question: have you received education training on data management? You need to answer yes. Question: what is education training on data management includes? Answer could be like data collection and analysis, use of data information for decision making, data/information confidentiality and security. Explain about project achievement work you have done in your area which have improved healthcare delivery. Example might be like for medical director we are using 100% electronic prescription. Human resource director, we have installed kiosk self-service machine. Staff can get verification later, check leave balance, etc. My advice to leaders: write your project achievements work on piece of paper point-wise and bring it during leadership interview. It will help you to explain your achievements project in an organized way. During leadership interview, don't try to explain your project achievements using projector, etc. Surveyor don't entertain it due to limited time. Okay, that brings us to end of my presentation. Thank you for watching, and I hope you found it interesting. If anyone has question, I will be happy to answer them. Send your comment, suggestion, or question in comments in YouTube comment sections. Thanks for watching. Please subscribe to my channel. Click here to get certificate of completion.